I'm Janice, and I'll be your nurse for today. And what is your name?
Navia.
Okay, and how old are you?
10.
Alrighty, well today you're here for a head-to-toe assessment, and I'll be going through different body systems, and I'll be asking questions. And if you have any questions, just let me know. And I'll also be listening and touching several different areas. Doesn't mean that anything is wrong. And if you have any discomfort or any questions, just let me know.
Okay.
Do you know who the president is?
Yeah.
And who is he?
Donald Trump.
Alrighty, and do you have access to 3 meals daily?
Yes.
Alrighty, and I noticed when you walked in, you had good gait and good mobility, and your posture was upright and straight. I noticed that you didn't come in using assistive devices, but do you use any assistive devices such as crutches, canes, or walkers?
No.
Alright, and is English your natural language?
Yes.
I noticed that you also are in a good mood. It seems like you are pretty happy, so are you normally in a good mood?
Yes.
Alrighty. And also your BMI is equal to your height and weight. Then next I'm going to be checking another system of... Okay, give a report to the oncoming nurse. We had a 10-year-old female come in for a head-to-toe assessment. Started the assessment. She stated her age, which was 10. She was alert and oriented ×3. Her nutritional status was excellent. She did state that she has access to 3 meals daily, and her BMI is equal to her height and weight. I inspected her while she walked in, and her posture, she had good gait and good mobility, and her posture was upright and straight. She did not use any assistive devices. I did not notice any physical deformities or any abnormalities, nor did she admit to having any physical deformities or abnormalities. She would seem to be and appeared to be in a good mood, and she stated that she was happy, and she is in a good mood. She stays in a good mood. Her natural language is English, and she was nice and clean. Her skin was warm to the touch, and she had good hair distribution. Her skin coloration was appropriate for race. Her hands were clean. Nail bed was clean. Her capillary refill was less than 2 seconds, and she had good skin turgor. Her peripheral pulses were palpated, and that was the radial and brachial. She also had good hand grip. Going to the head. Her head was nice. Ooh, that's something with my Her head was nice and round. Did not notice any asymmetry. Didn't notice any irritations of the scalp, no dandruff or no infestations. Didn't notice any lumps, bumps, bruises, or scars. And hair was full. Hair color was dark black. And didn't notice any hair loss. Scalp was non-tender to palpation. Then we move to the eyes. The eyes were clear without irritation or without exudate, which was the eyelids, the eyelashes, and the eyebrows. The conjunctiva was nice and pink, and the iris was dark brown. Her sclera was white, and her conjunctiva was viewed by the side view, which was round and non-concave. And then her face was symmetrical, appropriate to her race. Skin tone was clear and even, no scars, no irritations or skin problems, and then she denied tenderness to palpation to the facial area. The maxillary and the frontal sinuses were non-tender, and the temporal artery was without thrills. The cranial nerves 1 through 12 were all intact. Going to the ears were not irritated, did not have any discharge or drainage, no redness, and they were non-tender to palpation. Going to the nose was exterior was not irritated, did not notice any skin irritation, no discoloration. It was the nose was midline, the nasal septum was midline, the nasal patency was clear, and there were no nasal polyps present. Did not notice any discharge. Mucosa was pink, and non-tender to palpation. Going down to the mouth, the lips were dry. Were not dry. They were not irritated and did not notice any lesions, and they were non-tender to palpation. The mucosa, the gums, the teeth, the tongue, the tonsils, and the hard and soft palate all were moist. Did not notice any irritation, any loose teeth, or any abnormalities there. Moving down to the neck did not have any pulsations, no lumps, bumps, bruises, scars, or abnormalities. There were no signs of any inflammation or swelling. The trachea and the neck were non-tender to palpation, and the trachea was midline. Thyroid was palpated and it was not swollen, and it was non-tender. Carotid artery was no lumps, bumps, bruises, scars, no irritation, signs, symptoms of irritation. They were palpated one at a time, and they were auscultated bilaterally, and there were no murmurs or thrills noted. Moving down to the lungs were inspected and auscultated anteriorly and posteriorly. All lung sounds were clear in all lobes, anterior and posteriorly. Upon the viewing of the anterior, I did not notice any use of accessory muscles. Respirations were unlabored, and the respiratory rate was 18. Moving to the posterior inspection of the lungs, the scapula and spinous was midline, AP to T diameter. The CVA was non-tender, so CVA tenderness non-tender, and no forceful breathing was observed there. Moving to the heart sounds were auscultated, and they were auscultated sitting and lying. S1 and S2 noted. There was no S3, S4. Also, heart rate and heart rhythm were regular. Palpated for apical pulse at the 5th intercostal space, left mitral valve. Going down to the abdomen. The abdomen was viewed and inspected at eye level. It was a good contour, nice and flat, no pulsations and no visible peristalsis. The color was appropriate for race. Did not notice any scars or striae. I did auscultate bowel sounds. Bowel sounds were heard and they were present times all quadrants, all 4 quadrants, all lobes. Tympani were percussed in all lobes and all quadrants, and it was negative to light and deep palpation. So it was negative to light or deep palpation. Moving down to the lower extremities, the lower extremities were inspected, did not notice any discoloration, did not notice any varicose veins, and did not notice any peripheral edema, did not palpate any peripheral edema. The skin hair distribution was good. Peripheral pulses were palpated, femoral, popliteal, posterior tibial, and dorsalis pedis. Full range of motion of the upper extremity and full range of motion of the lower extremities. Good muscle strength of all upper extremities and good muscle strength in all lower extremities. Heel to shin test was negative. Babinski reflex was negative. Patella reflex was positive at 1+. and negative for scoliosis. Again, there was good hand grip, and that concludes my assessment.